Welcome to the student poster presentation webinar. This webinar is being recorded and will be available on YouTube in a few days. So even though you're attending right now, if you have to step out at any point, just rest assured that you will still be able to find all this information. All of you who are attending are going to be in the listen-only mode. So that means you can't ask questions during, you can't unmute yourselves, but at the end of the call, we will have a Q&A for the panelists, and you'll be able to ask all your questions. Her work has informed county-level health policy, including the adoption of a health facility monitoring tool in Nairobi. She contributed to policy review processes and has led community-based research that informed local health strategies. She's a JBI Certified Systematic Review Fellow, One Young World Global Health Fellow. Grace Mungai is a research intern at Shamiri Institute, where she supports the implementation and evaluation of youth mental health research. She holds a bachelor's degree in psychology with a minor in chemical dependency from USIU, and is passionate about advancing mental health through evidence-based research and community-centered interventions. Okay, Roy Monene is a service delivery intern at Shamiri Institute who holds a bachelor in arts in psychology, first class honors from KU, and is a registered psychologist. He has experience in mental health research, psychological program implementation, monitoring and evaluation, and project coordination. His work has also been recognized through his achievement as a runner-up in the previous 2025 Shamiri Summit student poster competition. So details about the this year's summit, where you guys are going to be competing in the student poster research competition. The theme, first of all, the game is afoot. So I'll have to give this back to either Christine or Marcy at the end during the Q&A, so they can explain to us better what the theme is all about. The event details, so dates are going to be happening between the 12th and the 13th. So that's Thursday and Friday, and between 9 a.m. to 5 p.m. at the Glee Hotel, which is in that's the Northern Bypass, around that area. So why participate? Because you guys are already here, and I guess you're already excited to participate, but you can sweeten the pot. First of all, the cash prizes. The winner gets 50,000, second up gets 30,000, and third position takes home 20,000 shillings. Above that, you also get visibility and recognition. You'll get networking opportunities because we have people from all sectors and people who are really vast and really connected into health who come for our summit. So it really helps you as a student or just someone who emerging into the industry at this point. Finally, you have professional development. So eligibility, who can participate? The Kenyan university students and specifically undergraduates. So you don't really have to have done psychology. You, as long as you work or your research paper or like what can I say, your research proposal has something to do with mental health. As long as it's touching on youth and mental health and well-being and resilience. You could be in computer science, but maybe you're working on that is still well connected in that. You could be in public health. You could be doing all manner of things, sociology. You could be doing chemistry, whatever it is, as long as your work is able to meet those two themes. So for the next slide, I'm going to pass this on to Charity, our very first panelist, and then she'll pass it on to Grace, who's our second panelist, and then finally I will take over, and then we'll close from there with a Q&A and continue. Yeah, thank you so much. Welcome again. Charity, please take over.
Thank you, Roy. I'm going to take you through how to write a great abstract, written abstract. We have two types of abstract. So I'm going to take you through the written abstract, and then Grace will come in for the poster abstract. So essentially, an abstract is not a teaser, it's a snapshot of the entire research that you have done. And what we're looking to have in every abstract that we will receive from you is it must have an introduction. So the introduction bit has, of course, to have a title and a background of the study. We want to know the why. So in the background, you just give some sort of context of what the research is about, and then the gap that the research was trying to fill, or the problem statement, in other words. And then we have objective and aims of that particular research. So these are research objectives that I'm so sure you had. And then we are going to, of course, have methodology. So every research must have some sort of way you went to collect data to be able to test your variables. So the methods must be clearly highlighted. We're also looking to have results in your abstract. So result is after you have gone to the field, or if you did a desk review, whatever kind of research that you did, we're able to get clear research results that you've been able to compile. So here we're not looking for subjective comments. For you to write a very great results, you have to be very, very specific with what you're indicating. I think I'll give you an example of this as we go through. And then if you have any discussions and conclusions and possible recommendations that you can be able to fit into the abstract, that will be greatly appreciated. Essentially, your abstract should not have more than 350 words. The 350 is a word limit, so that means a maximum of 350 words. From the background to the discussion and conclusion should not be more than 350 words. I'm going to share an example of an abstract, and so that you can be able to draft something similar to this. We have this research, effects of Shamiri layperson provided intervention versus study skill control intervention for depression and anxiety symptoms in adolescent Kenya. That is the research title. And then for the objective part, we have to assess whether Shamiri, a 4-week layperson delivered group intervention that teaches growth mindset, gratitude, and value affirmation can alleviate depression and anxiety symptoms in symptomatic Kenya. The method was a school-based randomized clinical trial, included outcomes assessed at baseline, post-treatment, and 2 weeks and 7 months follow-up from 4 secondary schools in Nairobi and Kiambu County, Kenya. So adolescents aged 13 to 18 years, that is some information on the studies participants with elevated symptoms on standardized depression or anxiety measures were eligible. Intent to treat analysis were used to analyze effects, and recruitment took place in June 2019. Follow-up data were collected in August 2019 and February 2020. Adolescents were randomized to the Shamiri intervention or to a study skills control. All adolescents in both conditions met in groups, mean group size of 9 for 60 minutes per week for 4 weeks. The primary outcomes were depression, PHQ-8 item, and anxiety, GAD-7 item symptoms. Analysis of imputed data were hypothesized to reveal significant reduction in depression and anxiety symptoms for adolescents assigned to Shamiri compared with those in the study skill group. So if you look at this, example that we have, you clearly see you must have a properly captured title of the research study that you intend to present. The objective is here you can be able to capture some sort of background and to give us an objective of the study. Like what has been captured here, we were looking at the 4-week layperson group intervention. We were assessing on its fidelity. And then the methods, clearly it's been indicated we have an RCT. You have to give us the type of research that you have done. If it is a descriptive study, if it is a qualitative study, if it is quantitative, whichever research model that you used has to be clearly captured. You have to, in the methods, you have to also mention the study site. In here, we mentioned Nairobi and Kiambu. You have to give us the study duration. You also have to be able to mention your study participant. Here we have been able to mention 13 to 18 years old who are in school with elevated symptoms of anxiety. Those were the eligible participants. And also In here, you can also tell us how you collected the data, if the data was collected through questionnaires, if you collected the data through interviews, if it was document review, whichever way you collected the data. And then finally, after this, of course, you come to the primary outcomes, where you just give us a snapshot of the entire picture. What were the results with the variables that you had, and what is the entire picture of the results that you have, and if there's any recommendations or if there is any discussions that you want to have included, that will also be okay. But ensure that we do not have more than 350 in the entirety of the abstract. I'd not finished, so we have the results bit. This I'm going to take you through. So of the results, we have of 413 students, 205, which was 49.6, were randomized to Shamiri, and 208, that is 50.4, to study to the study skills. So here we have two interventions. We have Shamiri and the study skills. So one group was allocated Shamiri and the other was to the study skills. The mean standard deviation age was 15.5 and 268 were female. A total of 307 youths completed the 4-week intervention. Both Shamiri and study skills were rated highly useful and reduced symptoms of depression, anxiety, but analysis with imputed data revealed that the youth receiving Shamiri showed greater reduction in depression symptoms and post-treatment. 2 weeks follow-up and 7 months follow-up and greater reduction in anxiety at post-treatment. That is 2 weeks. Of course, we have given you our computations and also our confidence ratios and all that. So it doesn't have to be as complex as it appears here. If you're presenting your abstract in the results, it doesn't have to be this complex. But I also don't want us to have a blanket kind of results. So a blanket kind of results is you mentioning that the results were very positive, or the results were promising, or the results were good. That is a very blanket description of a research result. So you have to be very specific, like what we have mentioned. 46% were this. This is what we got in 47. That is what we mean by results. And then finally, in discussion and conclusion, you can see we have indicated that both the Shamiri intervention and a study skill control group reduced depression and anxiety symptoms. The low-cost Shamiri intervention had a greater effect, with effects lasting at least 7 months. You can actually just counter-check with the results that has been highlighted up there. If attrition is reduced and the clinical significance of outcome difference is established, this kind of intervention may prove useful in other global setting where there's limited resources, mental illness stigma, or a shortage of professionals and limited access to mental health care. So that has been our discussion and recommendation, as you can see. So for a written abstract, my quick advice would be when you're drafting it, it has to be something that I can be able to read and get a full understanding of the entire research that you did without me having to read the entire research paper. It should actually pique my interest to go read your paper. So that is what we are looking to be able to have. I believe you may have questions and we'll be able to handle them later on. But for now, I'll have Grace come in and take us through visual abstract.
Okay, thank you, Charity. So for the visual abstract, it's basically a graphical summary of your research study. So it kind of provides a platform for engagement and sparking interest in the research study that you're doing. So it's a bit different from the written abstract, as you're using icons, charts, arrows, and text to give this summary of your research study. So you're typically translating your research into like a poster design from the abstract you've written or from the research study that you're doing. So for the components, we have 4. We have the title, so that's the title of your research study, and you have to accompany it by your name and the school that you're attending or the institution you're from. So ideally, this title should have like a large font size compared to the rest of the work. Secondly, we have the research design. So this is the study type of your research. So in that section, you're going to write whether or not it's an RCT, an experimental study, a qualitative or a quantitative study. And the third section, the method section, you should make sure to write on whatever tools that you've used during the research, any intervention that you might have used, any questionnaires, psychometric instruments that you've done, any procedures you've done, and data collection tools. And lastly, there's the results or expected findings section. So this is a brief highlight of what you found after doing your study, or what you're anticipating to find after conducting your study. Ideally, you should select one or two findings that you find to be very significant to your study. You don't have to list all the findings that you've gotten. And in the next slide, we can see an example of a visual abstract. This is a visual abstract of the written abstract example that Charity gave. In this case, we have the title, the Shamiri layperson provided intervention versus study skills control intervention for depression and anxiety symptoms. And also the second component is that the research study. In this case, the study was an RCT. And for the methods, you can see we have specified the population, the intervention that we've done, the setting or location of the study, and also we've included the primary outcome of the study. And lastly, for the finding section, you can see that it's quite brief. So you don't have to list all the findings that you get in the study, just the 1, 2, or 3 significant ones that you found. You can also see at the bottom, there's a reference section. So you can write a reference one reference that is significant to your study, or if you've published the work, you can write the reference of that work. For the visual abstract, it's important to note that you should use like a more uniform format. Make sure you use like appropriate font sizes for the title, for the headings and the normal text. So maybe a very large font size for the titles, a slightly smaller one for the headings, and for the normal text maybe maybe a 0.11. And also make sure that your visual abstract is not cluttered and is uniform in the sense that the icons that you're using should be related to what the study is about. Yes. And for any questions you might have, we can have them in the Q&A section. So for the next slide, Roy will give you a presentation of his previous application for the last year's summit.
Any of you were not there last year, I'm going to be doing the mock presentation because this is a project gained me second place in last year's competition for the posters session. So I'm just going to take you through my process of how I wrote the written abstract and then how I changed that into the poster that you see in front of you, right? So I'm not going to read through the, because I think if I start reading the whole thing, we're going to be here for a minute. But I'm just going to let you know how I was able to write this. So for all, starting, I'll say this. There are 2 ways you could submit, 2 types of projects that you could submit. You could submit like a speculative paper, or what you'd call a prognosis or forecasting paper. So that's a research paper that either is ongoing or you are, maybe it is based on another research that you've seen and it has sparked your, your interest, and then you kind of have a hypothesis, you get. So you have started, you've proven it, you want to start it. There's also, I guess there are 3. There's a second one, which is ongoing, and you can now report on like results or like findings that you're finding as you're continuing, as you're doing. And then there's a last one, which is now a complete research, where you are talking about your methodology from the beginning to the end, That is the research design, that is the data collection, data analysis, and data reporting and all that. So mine was a prognosis or speculative paper, meaning that I was kind of just had a hypothesis based on other research that I had seen, and I was like, you know what, these numbers kind of make sense in my head, and I want to present this and see if I can actually go to it as a research. So my research was about a specific project called Imagine. So Imagine is an art, it's a, what do you call it? It's an intervention that is taking both art therapy and nature therapy and putting them together. So first of all, you need to start by explaining, by giving that title. So that's what I gave my title. I came up with the Imagine, which is an acronym that I'll explain Hukumbele. And then have, now you kind of open that up a bit. What is Imagine? It is an intervention that is taking art therapy and nature therapy and putting them together for young people. So what's the background? When you start talking about the background, you want to explain to people, how do you arrive to this? Like, why should I care about this? What is the problem that is being solved here? So for me, the starting point of Imagine is a fairly simple problem. Young people are experiencing significant mental health challenges, but access to appropriate support remains very limited. And then background, I start by highlighting numbers, because remember, at the end of the day, this is a competition. So you also want people that you're saying. So I'm not saying quote numbers are, don't quote numbers because they're flashy and all, but it does help. So I went and did that, and I found that 44% of adolescents in Kenya have the problem here. And out of these 44, only 11% of them are able to get help. So the question became, if conventional mental health services are not reaching everyone, can we think of other ways of promoting mental well-being that is accessible, engaging, and relevant, specifically to these young people? Because you see, I've already quoted 44% of the youth. So the problem also needs to be targeting the youth. So what are the objectives? Objectives, you could put them in point form or like continuous prose I've done here. But I found it that it looks much cleaner when everything looks the same. So kila mahali I had like sentences, I didn't have point form. Because also, as Grace had said, the visual things should come into the poster. But this is because you can sit down with it and read through it, they can take the time. So just put everything in continuous prose. I feel like that would be the neatest. So anyway, the objectives of them, and you need to read them out very, very clearly. So you see mine, 4 of them, but they're just in one sentence. So put everything, remember at the end of the day, even if you're trying to give much information as possible, we've already been told that we have a word count of 350 words. And what you really want to sell people on projects is the methodology and the results. So don't spend a lot of words in the background and the objectives. Background you can. Okay, spend your time in the background explaining the problem really well. Explain the methods that you're using and the design and the data collection, data analysis. Explain all that and expect the outcomes. Conclusions and objectives don't have to be too detailed, because those ones can be summarized in a few words. Get that? I think that would be my best tip for that. So for the first objective was emotional literacy, emotional expression, and well-being. Second was to reduce mental health stigma. Third was to support early identification of mental distress and normalize mental health seeking support, mental health seeking behaviors. And finally, examine whether, because I told you guys this was a speculative research. So I looked at 2 researches, one of art therapy, and I saw that works. And I saw another one writing about nature therapy, and I was like, that works. So I asked myself, what happens if we take these two things that work and put them together? You get? So anyway, in the methodology, as I'd mentioned, mine was not something I'd done. I'd started. So I was going to talk about not the methodology in terms of like the collection tools. I'm not going to talk about the way I analyze the data. I'm not going to talk about the way I'm going to present it. I'm just going to talk about how I expect to design this project. So what I talked about was, number one, participants. who is the target audience, and I said clearly it is 18 to 24-year-olds. And I said that they'll be in groups of, let's say, I can't remember. Can I remember how many groups it was? I can't remember, but I think just do it 15 to 5 to 15 people a group. How long is it going to take? 6 weeks. What is going to be used in there? I'm going to use the PHQ-9, which is the one that tests for depression. I'm going to use the GD7, which is testing for anxiety. I'm going to use a WHO-5, which is testing for well-being, the brief resilience scale, and the expression of comfort skill measures. Like I just talk about all the things that I'm going to use. Yeah, I'm not going to talk about the things I don't have. Be very honest. Just let your work, if you believe your work, let it speak for itself. And expected results, what I did here is, because I've told you, I based my research on previous researches. So I took those numbers and said, for example, we anticipate approximately 10 to 25% reductions in anxiety and depression, because that is the base that the other two have given. So taking two things show that there's a 10 to 20% reduction in depression and anxiety, I expect that even if my research does not work the way I want, it's 2 times better, it's still going to remain at the same efficacy level. I don't know if we are following. I hope I'm not going too fast. If we are still together, send in a thumbs up. I hope I'm not being too technical. Okay, amazing. So, and then in the conclusion, so the conclusion is just kind of taking a bow and then tying everything together. So it's telling the person who's reading your work. So in conclusion, this was a problem. The problem is that the youth in Kenya have mental health issues. What does it have to do with me? I mean, what so? And then you tell them, then able to find help. And then the question becomes, what can we do about it? We need to find them help. And then you tell them, and this is why my solution can actually work. Just the visual or the poster that I made from this written abstract. What I'll tell you is it's very safe that the poster should be as visual as possible. Mine only has one graph, but that's because I did not have data. I was using secondary data. If I had more data, which I now do, I would have done more graphs, not to make it a pretty or whatever, it's to summarize things. So when someone looks at it, they quickly grasp things just to make things easier. You get? But what else I can also say about this is this should also encourage the person who has an idea that they don't know, they have not yet started, and they think, can I actually do this research between now and the deadline? You don't actually have to. As long as it's a good idea and you have enough numbers and data to show that this is a viable research project, you can. I went against other people. It's not like I'm bragging, I'm just trying to give you. I went up against that people had different levels also. There's someone who had completed, someone else was halfway, other people had not yet completed, just like me. And at least one that was not complete or even started still ended up in the top 3. As Grace said, please make sure that all your titles have like big font size. As you can see, imagine integrating art and nature-based interventions to promote youth mental health in Kenya. And then on the side, I wrote my name and the institution that I was from. So Kenyatta University, Roymene. And then I went into production. So basically what you're going to be doing here with your poster is just taking your abstract. You don't need to start redesigning words for your poster. Just take your written abstract. If it's written well, if you take time and actually write that really well, you can just carry that over and then just paste it here. And then you just cut a few things here and there. When you do the word count, now you get more space to include charts, graphs, and images and all that. So I talked about the introduction, I talked about the problem, I talked about the numbers, and then I went into objectives. Now here, as we said, now this is where you need not forms. Have bullets, have numbers, have them numbered, have them like sequentially follow each other. So I talked about the 4 objectives, and then I went into the methodology. This is when now I talk about the 6 weeks, and I'm talking about each pillar. So I told you Imagine is an acronym. So the first week is about introspection. So that is looking inwards and trying to understand what is the issue, what issues I'm going through. second one is motivating. So by going into nature excursions and then trying to find that motivation. Number three is asking. So this was going into group discussions and group therapy and just having conversations with people. And then grounding. So grounding is where we teach people different mechanisms that they can use, make sure that they are calm, that they have their mental health in check, and then integrate and analyze. So taking those tools and then making sure they really integrate them in normal life. Like, for example, if it's journaling, you put it into your timetable. You find something, something of that sort. And then now express is, for example, now is proposing that you have like an art gallery, because there's going to be like in motivate that the nature excursion. You go for the nature excursion, you make an art piece. So with all the art pieces you've made in all 6 weeks, you're able now to show them during this last week at a public art exhibition. So that's, for example, so that's the methodology. So I talked about the 6 weeks, what are we going to be doing in that time period. I talked about the intervention techniques. So I talked about the psychological principles, therapy, nature therapy, and talk therapy. I talked about the evaluation tools. What clinical tools are we using? So GAD, PHQ-9, WHO5, BRS, and all those things. And then expected results. So this is where now I at least could up chart, and I did the background. I just showed that those, as you can see, I'm quoting people's research work. Kina et al. 2010, and Stark and Nobel 2010, Kaimal et al. 2016, and all that. So basically, that's what we expect from you guys. If you have your results, obviously you're not quoting other people, you're putting in your charts, your bar graphs, or line chart, anything, but that's going well. So finally, now we have the conclusion. We told you guys, it's just you guys just selling it. You already have put in all the works. It's just kind of like telling people, yes, and now I'm done. Thank you so much. That's basically it.
Everyone, thank you so much. So we can talk about the timelines before we head into the Q&A. So we are going to be opening the call for submission 1st September. And because you're already part of this webinar, you'll receive the notification once the application goes live. And when you actually submit your application, there's going to be a link where you can see this PowerPoint, a recording, and we're also going to give examples of abstracts to guide you. We recommend viewing the video again, also viewing the PowerPoint presentation that's going to be attached to the submission application form. We are going to close the form 30th September, 11:59 p.m., and the form closes automatically. We won't accept any abstract via email or LinkedIn or like anything else. We only review applications that are submitted via the submission application form. And then should you proceed to the next stage, we are going to notify the finalists by 30th October. And even if the news is not positive, you will still receive a notification regarding the outcome of your submission. We have the summit happening 12th and 13th. So on the first day, which is the 12th, it's going to be a Thursday. We hope that the top 10 participants are going to present the presentation, the submission on the main stage in front of our judges and our guests. So think of this as people also knowing about what you've done, who you are, your research. And then the next day, which is Friday, 13th November, the judges are going to announce the top 3 finalists. So number 3 is going to receive 20,000. The second one is going to receive 30,000, with number 1 receiving 50,000. And the top 3 finalists are also going to receive a trophy along with the cash prize. And then 1 week for the finalists, you will receive your cash prize through M-Pesa. We don't do checks, we don't do physical cash, strictly M-Pesa. So just again, planning wise, if like you do proceed to the final stage, make sure you have an M-Pesa number attached to your name not anyone else. Just for a part, when it comes to auditing, it has to be linked to your name. Yes. Maybe if anyone has any questions regarding the deadlines before we go to the general Q&A, I can take over. I know also there's been questions about transportation accommodations. So if you are a finalist and you are invited to actually present your research on the main stage, Shamiri will cover transportation within Nairobi. So if you are from Thika Road, if you're from Roysambu, and anywhere within Nairobi, we will cover transportation for both days. You will also receive a complimentary ticket to attend the summit for the 2 days at no cost as well. If you're applying for, let's say, if you're applying from Nakuru, from Murang'a, Shamiri won't cover your transportation from Murang'a to Nairobi. We'll only pay your transportation from Nairobi once you've arrived. And so we send the money to you at least 24 hours before the event starts. Once you confirm that you will show up at the event, you'll receive your money again on your M-Pesa, and then on the day of the event, we expect that you do show up. Accommodation, unfortunately, we won't provide accommodation to anyone. And when you submit your application, we'll also just put this in bold so it's clear to anyone applying that we don't provide accommodation. So just plan accordingly. Yes, we can move to the Q&A unless anyone has any questions regarding the timelines. I can also maybe just bring up some of the frequently asked questions that people asked when they were registering for the webinar. I know some people asked if they can submit a group presentation, if like you're a duo. Unfortunately, just for us to make sure we reward accordingly, we only accept individual submission, and it has to be original submission. So if you did group work, unfortunately, it's not eligible for this particular competition. And then we also are only accepting submissions from undergraduate at this stage. It won't be fair for us to put to have a pool where we have a graduate student applying for the same prize as basically someone who's like in their first year or like still doing the studies. So we only accept undergraduate submissions. There's also people asked about their major. As Roy mentioned at the beginning, you don't have to be a psychology major, but just chances are if you're a psychology major, you probably have done research in mental health. But again, you can be in tech, and then your research is maybe about like mental health literacy when it comes to like tech, maybe how tech affects the youth's mental health. So we're not restricting only psychology students, but your research that you do submit has to be strictly about mental health. And this year, it's different from last year where we actually don't want like this time we are open, so your application doesn't have to tie in with our Shamiri theme. As long as it's about mental health, you're eligible to apply.
Good evening.
Good evening.
So my question is, when I'm selected for in case for the top 10 presentation for the pitch, and I'm from Kisumu, so I can't request for an online pitch through Zoom or anything like that. I must be physical.
So ideally, the way we are gonna be planning this section for the agenda on the actual day, we also hope for it to be a networking presentation where the judges can also ask you questions, like during your pitch, but also should other guests have any questions, they can easily approach you. So that's why that's why this year it's going to be strictly in person, because we want you guys to be on the main stage. Have I answered your question, Melanie?
Yes.
Okay. Jeffries, Gloria, you can ask your question.
Okay. I have a question on the eligible people who are eligible to present. So you said something about you won't allow, or it's not like advisable for a graduate student to present because it only undergraduate can present. So what if like I graduated recently, like December, I graduated in December, am I allowed to participate?
So but right now, are you a graduate student or you finished undergraduate?
I completed undergraduate in December. So am I eligible to participate?
We can confirm that, but I believe last year we had people who submitted the application because I think it was part of like their thesis. So I believe that should be okay because I'm assuming you are yet to like have like a graduation ceremony, but I think that should be eligible, but just
Okay,
not
we already had a ceremony.
Sorry, what?
Sorry to interrupt, but I already had a graduation ceremony in December. I graduated in December.
Okay, maybe for that we can do like I think I see Faith has a response to that question.
Yes, I think it's okay even if you graduated in December, as long as the research you're presenting was undergraduate research. So if it's research that you did when you were in your undergraduate, then that should be okay.
Eunice?
You mentioned something on the research being specifically targeted towards the youth. So even if the research is a mental health paper, it still has to be specifically and exclusively the subject of the research has to be for the youth.
Yes, ideally, because our summit revolves around youth mental health. Right now, we are targeting youth mental health. Yes.
Okay.
I would like to ask Roy when he was talking about the types of projects, the 3 types of projects. I only got the speculative and the complete research, but I didn't understand the second one. So kindly ask for more clarification on that.
Okay. Hi, Sarita. So first of all, please don't quote me on the types of researches. That was just off the top of my head, but it's just kind of categories of like where you're at in terms of like completion. So in terms of like your own data from the research that you're doing. So personally for mine, because I did not have any of my data because I had not started doing research itself, I would call that more of like a proposal research or like more of like a prospective research because you're kind of proposing an intervention and you are projecting numbers. You're like, this is what I've seen from other researchers that are close to this or adjacent to this. So this is what we expect a hypothesis making. The second one is now where you are in the middle of it. So you might find that you have already done the research design. Like right now, mine is in the middle. The same one that I presented last year. I already had done the research design last year. I knew how I want the program to look like, and then now I've actually started doing it. So I already have the data collection tools, and I already have the data, but I'm yet to analyze it. So when I'm presenting, I'll present this is what the design looks like. This is what the data collection tools look like. This is what I'm going to use to analyze. These are the tools I'm going to use to analyze. And then I'm going to still talk about the expected results. I'm not going to talk about results like findings or outcomes. So that's the second one that you're asking about. And then finally, obviously, now is the completed one, where you're able to say everything from start to end, and you're able to clean it as your own. You're saying, this is my research design. This is the research tool I'm going to use in terms of data collection, data analysis, data reporting, data, presentation. And then these are the findings that I have, and these are the conclusions, and these are the recommendations. I hope I've answered.
Yes, thank you. But I would also like to ask which of the 3 projects make you like stand a better chance, or is it like the quality of your research or your project that makes you, like, yeah.
Quick, but I think the best person to answer that is Faith, who is the head of research at Shamiri. I'll say there isn't really one that is better than the other. If I remember quite well, in first position, okay, in the last year, we actually had all the 3 represented. All the 3 were represented, with mine being kind of like at the start. Mine was not at the middle. It was at the start. I just have an idea. I have a hypothesis. I'm yet to test it. but I was able to put it across in a way that was convincing, and not just convincing, it is very possible and plausible. And then we had the person who had done it halfway, and it looked very promising. And we also had the person who had completed it. And when you look at all the data, it makes sense, and it is actually very applicable. So I would say it's more to do with your ability to actually sell your idea and also the quality of work. I don't know if Faith has anything else to add to that.
Sure, thanks, Roy. Just like you've said, it's really about the quality of the research itself and the abstract that you are sharing. Even if it's a proposal, we need to be able to see that all the other elements that are part of the proposal are explained clearly and that you have a hypothesis that you are leading to. So it's just about the quality of your research. Don't be afraid to share even proposals or research that you have only preliminary results. That will be okay.
I'm seeing someone asked in the chat, on the Shamiri Summit day, can anybody attend, or is just who are selected to present their work? So if you're selected, you will attend to present your research on the main stage because you are going to receive a complimentary ticket. But then, should you not receive positive news, you are still free to attend the summit, and we on our part can offer a student discount code for you to attend. We're also gonna be releasing some scholarship passes to students. So if you're interested, once the tickets go live and you haven't been selected to come present your work on the main stage, I'm happy to share the scholarship passes with you. I think someone raised their hand. How much? So Melanie asked how much are the tickets? We are still working on the final pricing, but we'll share that with you guys once our ticket sales go live. But we will have a price for students for day 1 and day 2 at a discounted price compared to last year. Based on the feedback, it's gonna be more affordable than the price for last year. I think Eunice already answered this question. Oh, so can the research topic, maybe Faith, you can answer this. Can the research topic lean into a particular subgroup among the youth? For example, university students, gender.
Yeah, definitely. It can lean into any particular subgroup as long as it's still about youth mental health. The reason we didn't want to specify too much is that there are different topics that you can have under youth mental health. So as long as it falls within that umbrella, it's fine.
Josh, do you have a question? Josh, Feather, I don't know if you have a question.
Okay, I was asking, hypothetically, you're qualified to attend the summit for the presentation, and unfortunately, you're kind of held up during that day. Maybe you're sick or you have cut because I'm an undergraduate student. How is that gonna be addressed?
So usually, as part of your application, your confirmation is needed for the summit. So on our part, we'll reach out to you 24 hours in advance to make sure that you're gonna attend the summit. If you do say yes, then we'll give you the money for you to come to the summit, for like your Uber money or like your bus money. It depends on how you want it. But on our part, we only give you the money once you confirm your attendance. So for example, if let's say you are sick, unfortunately, and can't make it, then unfortunately you won't be part of the application pool in that for the main stage. So then we're probably gonna reach out to someone on the wait list to come and replace you. But on our part, we'll make sure like every stage, we want your assurance that yes, you can make it. Yes, Melanie.
You've mentioned that you'll send an email for me to confirm that I'm able to attend the summit.
Yes,
24 hours prior.
No, so we are gonna have different email communications to everyone. So the first email communication is for everyone who is interested, and then the pool reduces. So we have like an open call for everyone, and then for the ones who submit, there are gonna be 3 categories. So rejected, waitlisted, or moving forward to the next stage. So once you are denied to move forward, that's the end of our communication with you regarding the next steps. So if you're under wait list, we'll tell you just to like keep wait, and we'll even share with you additional guidelines or feedback from the judges should just in case something like so for example, let's say finalist A like drops out. We'll also send let's say waitlist applicant guidelines on how they can improve their application. So once someone drops out, then this waitlist person can come into the pool again. So now we have waitlist and the finalist. Then for the finalist, we are gonna have at least like 2 weeks of communication. So once like you're sure you're happy with this presentation on our part, we'll print your poster for free at no charge. So again, that means we have like your assurance. So if let's say you send your poster to us for printing, that signals that yes, you will show up to the summit to present your poster. Then once that's done, let's say 1 week, we'll tell you guys, hey, can you please tell us where you're based from in Nairobi? So on our part, we also have like an idea if let's say someone is coming from, let's say, I don't know, Ongata Rongai, and someone coming from Kiambu Road, it makes sense for us probably to give more transportation money for the one in Ongata Rongai than the one from Roysam, just because Glee Hotel is closer to Kiambu Road. So again, if later they all so you guys submit like your location, that so also that means okay, they're gonna show, and then 24 hours we say, hey, like Melanie, are you sure you're gonna show? Then once you say yes, we send you the money for you to come to the event. Yeah. So on our part, every stage we will communicate with you. And if you have any questions, just email us. And on our part, I think we respond like within 24 hours. So yeah.
Was this research summit and Shamiri research competition designed for students within Nairobi only, or students from all parts of the country?
So ideally, right now we are looking for university students just around Kenya, but also just because of like our budget constraints, right now we're able to just cover transportation costs for like once you're in Nairobi, like within Nairobi. So that's why even when you do submit your application, we are going to mention that. And before you submit, you acknowledge that Shamiri will only cover your transportation costs within Nairobi.
Okay, it's not about the transportation fee.
Yeah.
It's about what if I'm on the wait list and you inform me 24 hours prior.
No, but
Very
you see,
difficult.
no. You see, on our part, we won't do that. So basically, so for example, let's say we do have our finalists, we give them like a time to respond that yes, like that yes, they are okay to proceeding to the next, and then they can make. Sorry. So did you say something, Melanie? So on our part, we won't tell a waitlist candidate that, hey, tomorrow is the summit, like please attend. No, on our part, we won't do that. We'll give you at least 1 week notice. Yeah, and also if let's say like on like 24 hours, someone says no, on our part, we'll do away with that, and there's no point for us to replace someone who's probably on the waitlist, because that means we also have to like print their work as well. So on our part, we won't do that. Yeah. Because 24 hours is too short of a notice for someone from the wait list to then be told to come and present their presentation at the summit. We're also gonna be having office hours. Jeffries, let me just finish this. We're also gonna be having office hours. So we're gonna have them, we're gonna have 2 types of office hours. So when the application is open, so if you have any question regarding the application, any abstract writing, but then on our part, we want you give we actually won't give you feedback on like what you hope to actually submit, but just like guide you on like tips. And then we also have office hours for finalists if they have like additional feedback regarding their PowerPoint presentation. Yes. I think Jeffries, you raised your hand.
Okay, I wanted to ask, so you said that we are not allowed to present group projects, right? But also you said we are allowed to kind of cite any reference. So what if my project was a group one, but I want to build on it? Am I allowed to do that and present it now? I want to build on it now. Like it is already done, we already completed, we already did the study, we already got the results, and I want to now kind of, build on it, make it more relevant. Am I allowed to do that?
Faith, are you able to answer that on the lens from a judge?
Yeah. So I think it would depend on what you mean by build on it. There would need to be a distinct difference between what you did as a group and what you will be presenting individually. And this is not even just coming from the lens of just a judge, but also thinking about the people that you did the group project with, because you can't take their work and then replicate it and say that it was just your work. So it would need to be very distinct from what you had done as a group. And probably something that you should think about being able to explain is that difference between what the group project was and how you built on it, how you changed it to now develop the individual project. Does that make sense? Okay. While I'm here, Christine, I think I can answer the other question in the chat from Atieno. So the question is about what if somebody did a research project for undergraduate, but it was out of mental health? Can one be allowed to change it and align it to the mental health, since it's something to do with the field of education? So again, similar to what I was just talking about, it depends on how you plan to change it. So I don't know if this means that you had some measures that had something to do with mental health, and now you want to do a different kind of analysis and then present that. That would be perfectly acceptable. So it just depends on what the change is. If it's like a reanalysis, that should be fine.
I'm also seeing Cosmos, you asked about the ticket sponsorship. So on our part, everything is gonna go live 1st September. So on the website and on our LinkedIn and Instagram pages. So right now this is still like behind the scenes, but everything will go live 1st September. And then on our part, should you want to come to the conference under the scholarship pass, I'll email all you guys in this webinar to apply for that scholarship pass. So on our part, we'll email you guys, but also there'll be links on the website itself. Yeah. But everything goes live 1st September. So website, ticketing link, and the scholarship, the submission form for the student poster competition. Yeah. Maybe Faith, again, over to you. Someone asked, why will someone be rejected?
So similar to what Roy, Grace, and Charity talked about, it's about the quality and the clarity of the abstract that you will share. So the only reason you'd be rejected is if the quality of the research that you've shared maybe is not as good as others. We're not saying that it is not good. This is a competition, and there are some proposals that will be better than others. But you might find that the research is at the same level, but the way you present it to us is not as good as somebody else's. Because when we are going through the abstracts, we will not be in a position to contact you to ask you to clarify some things. So if something is not coming across clearly in the abstract that you have shared, unfortunately, that means that somebody might do better than you and might be chosen over you. So make sure that your abstract is very clear. It captures everything that we've talked about in this webinar, and that even looking at it from the lens of a judge, this is something that somebody would be able to understand very well. It is original research, and that's pretty much it. So again, not saying that rejection means that your research is not good. We just need you to present it to us in a way that can be understood and can be judged on, can stand on its own and can be judged on its merits. And that's why we'll be having the hours that Christine has mentioned, where you can email and you can ask a question, not about your research, but maybe if you want to, if you're not sure about how to present it or how to like write it, this will be shared later. You can ask questions about that so that you can have a strong presentation. No, Melanie, it's not an essay. We'll also share the guidelines after this. So you should be able to see exactly what you should be able to share with us. Christine, can you handle the one about the theme?
Yes. So Rachel asks, is the research supposed to follow a specific theme, maybe like this year's theme, or can it be about anything? So based on last year's feedback, this year we're making it broad. Your topic just has to be linked to youth mental health. Yeah. So it doesn't have to tie to Shamiri's theme for this year. So as long as it's about youth mental health, that should work. Maybe I'll pass this to Charity. Someone asked, how will you ensure impartiality and equal consideration for all participants?
I'll ask Faith to take that on.
Yeah, sure thing. When it comes to impartiality and equal consideration, first of all, when we get your abstracts, when you submit them, they will be rated by a panel of internal Shamiri judges. So it will not be people from like your university or anything like that. And we should have at least more than one person rating a submission. So that way there should be some alignment and some equality in terms of how it's being judged. And when after that, when it comes to the 10 finalists, those submissions will be judged by external panelists that we will be contacting. And I think you will see who the panelists will be in the coming weeks. And they will be external Shamiri people. So that way people also can't say that, you know, somebody has a link to Shamiri and that's why they were chosen. We will try to keep it completely impartial, and even the rating of it will be using a rubric. So it will just be based on all of that. I don't know if you had a specific concern when it came to consideration and impartiality. If so, maybe you can highlight it in the comment or raise your hand and ask if you had a specific consideration. Melanie, can someone also talk about youth mental health providers? I think that is also okay because it's still linked to youth mental health. I can see there's a question by James. Charity, you might be able to, could you field this one?
So they asked Charity, so only the abstract is needed throughout the competition?
I would say yes. So that's why we're insisting on a well-done abstract, because I don't think we'll get the time to review all the research reports that will all have been submitted. So just ensure that you have a very well-done abstract, whether it's written or visual.
Yeah. And if at any point you're not too sure about what the requirements are, again, don't worry about it. We'll be sharing a document that will outline what the requirements are and what you need to submit. So it should be very clear from there as well.
All right. I think that's it. Thank you so much for attending. On our part, when the submission link opens, we'll also compile a frequently asked question because we realize that most of you guys have similar questions and not everyone was able to attend this webinar. So on the submission form, we'll also put all the questions you guys have asked for others to also know the answers. So Sandra asks, can you submit both written or visual abstract? So actually, actually on the submission form, there's gonna be a part for written abstract and a part for visual abstract as well. So you submit both, not one. Yeah. Yes, if you guys have any questions, our email is summit@shamiri.institute, and we respond to emails within 24 hours. So we are happy to answer any additional questions. I also want to thank our panelists, Charity, Roy, Grace, and also Faith for answering all the research questions. Thank you so much for taking your time. Also, thank you guys to the students who did show up to this webinar. I know it's like Friday evening, but we do appreciate you. We'll also be sharing a thank you and next steps. So you guys are going to be aware regarding the next steps. But on our part, we are going to be communicating with everyone accordingly, depending on which stage you are in. Yes, anything else from the other panelists before we close it?
I think I would just say please share this opportunity with your friends and any other people that you think would be relevant for this, so that we can get the message out there, and just so that we can make sure that we are highlighting as much youth-led research as we can and advance the field of youth mental health.
Thanks, Faith. All right. I think that's it. Our email is summit@shamiri.institute. There is no .com, so if you have any questions, feel free and we'll answer them. We'll also share this recording within a week. So again, we recommend reviewing the recording before you submit your application to just make your application stronger. All right. Thanks, guys.